From face masks to power grabs, today we're diving into how states are planning for the next great public health mess. Welcome back to Beyond the Bill Number, where we dig into the legislation shaping your life, one bill and one heated state house debate at a time. I'm Sarah.
And I'm Stephen, here to make your Monday scaries just a little bit more pandemic prepared.
Speaking of pandemics, today we are tackling what state legislatures are doing to prepare for the next big outbreak, because unfortunately, it is not a matter of if, it's when.
Yes, absolutely. So that's right. COVID may be retreating in the rearview mirror, but state lawmakers are just getting warmed up. Some for science, others, well, maybe just for show. And we do keep mentioning the aftermath of COVID whenever we discuss a range of different topics. It was just so fundamentally changed so many different things. So maybe it's about time that we just tackle it all head on.
Before we get into the doom of gloom of revisiting what another time of COVID might be like, let's elevate the situation for a second and maybe share our funniest story from the beginning of the pandemic. We were all obviously put on our heels. We didn't quite know what was going on as a world, as human beings, and there was some things that were truly out of pocket occurring. So I'd love to hear yours, and then I'll share mine.
Well, I mean, the problem I had is that I'm a big fan of apocalyptic science fiction. So a lot of the zombie apocalypse and all various different things that go wrong. I sort of find it quite morbidly fascinating how vulnerable our society is to a range of different threats. And so when this happened, it was like all of those things I've read just coming true in my head. And I sort of freaked out about it. So we were filling boxes with food and all this non-perishable stuff, literally filling up big bottles with water because we thought the water was going to go off. I mean, we thought it was the end, for a short time there. It was like, oh my God, there'll be no food, there'll be no water, power's going to go out, it's going to be terrible. And it's slowly over time we realized it actually wasn't going to be quite that bad, even though it was absolutely bad.
My husband and I actually both traveled the weekend before the world shut down. And my husband went on a work trip and I went to go visit my best friend out in Minnesota. And it was funny because in skiing, you can wear things over your face to protect you from the wind and snow and stuff. And my mom had given us these buffs that had silver thread in them that were supposed to be like antibacterial, microbial, blah, blah, blah. And this is way before anybody was wearing any masks. Everybody was still kind of like, what's going on? Also, they were hideous. Mine was ombre blue cheetah print, the ugliest things I've ever seen. My husband and I were like, what is this gonna do? To be fair, what was that actually gonna do? But we thought it was like so hilarious that my mom was like, wear a mask, oh God. And then truly 4 weeks later, we were driving to our friend's house because she knew how to sew and was sewing all of our friend group's masks, and we were dropping them off at people's porches and like wearing them. My favorite part of the pandemic was when everybody decided that yes, we should be masking and it is important to do that, but the things that Americans were putting on their faces to try to be masked. I will never laugh so hard at anything in my life. I was like crying every day on Twitter seeing these pictures of people at the stores with a sponge bungee cord to their head.
I know. It's just crazy. And I know the people put masks on but then didn't cover their nose. And that for some reason became a total bugbear with me. I used to, every time I saw someone on the TV or I was screaming at the TV, don't bother wearing a mask if you're not going to cover your nose. It does absolutely no good. Just don't bother. Don't even pretend.
Also, this story and even what you were saying kind of proves the point of everything that we've kind of learned to understand since the pandemic of how we are so absolutely ill-informed and unprepared for things like this. So, I mean, let's set the scene for what we're talking about today. So, COVID-19 hits, confusion reigns, present company included, and people hoard toilet paper. They then start baking bread, and we kind of get into our little nesting time, and it's kind of, when are we going to go back? Okay, we're not going back. This is happening for months on end. How are we figuring out how to play the same board game 15 different times? But the US ends up with 1.1 million deaths. That's more than any other large country. And how did we fare so badly here in the States even?
So every time I use that statistic, I have to Google it just to check because I think that can't be right. It can't be right. 1.1 million deaths, but that's what the official statistics do say. A million people, more than a million people actually in America died. And It was worse than any other country, and the reasons were various. There was a patchwork response. There was political dysfunction, frankly, very slow federal action. There was early uncertainty. So at the time when it could have been nipped in the bud, you could have stopped it. That action wasn't taken. By the time people got serious about it, the virus was already spreading everywhere. And then various measures were implemented to stop the spread, which just weren't going to work because it was already everywhere. Then there were decisions about restrictions, masks, vaccines, and so on, and they became deeply political and sort of split the country in a way that was really unhelpful.
Right. And I also think a big part of it here was because it was so fumbled from the beginning and became so bad, it went on for so long. And then some people who were respecting it then stopped respecting it because people were just dying to get out of their house and away from whoever they were living with or by themselves, you know? So it's definitely a mix of public distress and inconsistent messaging, I would say, which was a very deadly combo. So enter Washington State's House Bill 1531. This bill passed in 2025 and says, hey, maybe next time we should use science. It's a bold move, right?
Yes, yes, it was. It's a great bill, actually. Very bold, particularly these days. It says public health responses should be based on the best available science, even when certainty. So it's a really, really clear approach here because this was one of the big issues, wasn't it? The science changed during the pandemic and everyone went, oh, well, that just proves scientists don't know anything. No, no, you have to go with the best available science. Science will catch up. It will figure out the answers. But the best response is whatever the best available science is saying at the time. It sort of recognizes that in a crisis, the fast action matters more than having perfect data on which to base it.
Yeah, and specifically, it calls out the need for clear science-based public communication, which was sorely lacking last time.
Yes, absolutely. I mean, in the UK, we had a daily briefing where the Prime Minister was there, but then standing next to him was the government scientific advisor, a very well respected individual, and he was giving the science, and they long, boring PowerPoints and things effectively, but people were watching them because it was the time when you wanted people to stand up and give boring PowerPoints telling it was all going to be okay. Obviously, often it was saying it wasn't going to be okay, but at least it was sort of justifying the actions that were taken and really saying this is why you need to do what we're telling you to do because look at this graph. So in the US, though, that was lacking to a certain extent, I think. And
Yes.
This bill is really trying, at least for that one state, to sort of turn this around and stopping local governments from blocking this evidence-based state policies as well. So no more sort of every county for itself, because as we know, viruses don't really respect county borders. So it's a serious effort to centralize and streamline this pandemic response.
Okay, so what is the rest of the United States up to? Well, we've tracked 57 related bills, and partisan lines are, shall we say, crystal clear.
Yes, yes, they really are. So you can find links to all of these bills in the actual blog post on our site. But partisan is putting it mildly, really. Of the 57 bills that we identified, 46 were Republican sponsored, and virtually all of these aim to limit public health powers, especially those of governors.
All right, let's get into examples. Florida passed House Bill 6011 and Senate Bill 340, and these restrict state compliance with the WHO or World Health Organization unless lawmakers say so, which, ugh. And then we also have Idaho's Senate Bill 1038, which goes even further, saying nah to any WHO mandates.
Yeah, so these bills they just reflect these real concerns about sovereignty and democratic accountability. But in practice, looking at the premier sort of public health organization in the world and saying whatever they say, we're not doing it, it could really slow critical responses in a crisis and just end up with states going in the absolute opposite direction. It's almost like saying whatever the WHO says, we're going to do the opposite because what are they? What those scientists and doctors know. Right.
Something that we talk about a lot is how much lawmakers don't know about a lot of the stuff that they're legislating, especially when we're talking about AI, for example. And so just saying we're not doing anything unless the lawmakers say that they agree with the WHO, like what basis does the lawmaker have to stand on whether or not they agree with the WHO? That doesn't make any sense.
On sort of virus timescales, which we're talking about days to be able to act. You're going to stop a virus. You haven't got time lawmakers to become experts in things they know nothing about and then debate and actually make decisions. Yeah,
Yeah, yeah.
it's not.
Okay, let's get into the hot button topic here with the pandemic, vaccines. So this was the hot button issue, and it just won't go away. It's really kind of taken on a mind of its own. We already had a big anti-vax movement here because of the pandemic and all of the COVID vaccines and mandates there. I feel like that has just been fuel to the fire. And it's really scary thinking about what could be moving forward. But we have this Connecticut bill, Senate Bill 707, which wants to ban mandates for emergency vaccines and stop anyone from asking your vaccination status.
Yes, we've seen a lot of these bills over the past few years, basically saying that states and health officials really shouldn't be able to tell people that they have to take a vaccine, which is a real problem when it comes to vaccines that you need everybody to take for them to actually be efficient. But on the other side of this, you've got New York's A3325, which goes the other way, trying to get rid of non-medical exemptions to vaccine mandates altogether. So this is basically saying, yeah, okay, if you can't take a vaccine for some sort of health reason, you've got that's fine, but not just because, say, it's a religious belief or whatever. So it's a public health slam dunk, really, but politically, obviously very radioactive.
Oh yeah, I remember when I was at the beginning of college, I'm vaccinated and my roommate wasn't, and she is not religious and said that she was citing religious exemption for vaccines, and I was just like, what kind of mental gymnastics are we doing here? But okay. And that was the first time I had seen something like that, and it was good to be exposed early because here we are today. So
Yes.
let's also not forget that the White House weighed in with a February 2025 executive order banning school vaccine mandates, which, now there's measles outbreaks, there's all this stuff going on. And we're not just talking states here. This is at the federal level too. And let's kind of get into the executive power conversation of this. We've been talking a lot about executive power this year because it seems like a lot of stuff is going around that the executive power seems to be hungry
Yeah.
for, I guess. During COVID, governors made a lot of calls, some life-saving, others controversial. What is the legislative response?
Well, in many states, it's handcuffs. So Maine's LD 551 and Minnesota's HF 288 now require legislative approval to extend emergency declarations past a few weeks. New York S 1435, same story really. You've got bills in Texas and Iowa that require the legislature to approve measures or stop the governor from closing businesses or even stop the governor from imposing mask mandates. So there's a lot of bills that are seeking to rein in this executive power and hand that power basically back to the legislature or just not let them do it at all.
Okay, so now also the digital age dilemma, contact tracing. Minnesota's House File 394 bans mandatory tracing and demands that data be deleted within 90 days. It also stops employers from requiring the tracking apps.
Yes, so you can understand from a privacy point of view why states would want to do this, and particularly states like Minnesota, really. But it's an absolute nightmare for disease containment because that track and trace, particularly in the early days, is absolutely crucial to help identify and isolate cases before they spread. So you can stop everything else if you get the track and trace right at the beginning. And without it, you're flying blind. You don't know where the disease is, how it's spreading, what you should do to try and combat it.
And how to be a responsible civilian to your community, which I think is a lot of the issue here. But okay, so 50 states, 50 different playbooks. Here we are, patchwork 2025. What is the danger in that? What could that possibly?
Confusion, mixed messaging, and outbreaks that easily hot borders and spread around the country. So we saw during the pandemic people traveling to avoid the restrictions. In future pandemics, you could find that control is nearly impossible. And if you contrast the US with countries that are really locked down fast, some of the East Asian countries and so on, then you can see the way they did it is through this centralized control, really quick decision making, and quite draconian restrictions on public liberties. And America never went there during the last pandemic. It looks like the next one, even less so.
That is really proved by these bills like quitting the WHO. That's not just isolationist, it's dangerous. Okay, Stephen, bring us home. What is the sweet spot between government overreach and saving lives?
Well, the crucial rule here is that speed matters, but so does oversight. So Washington's HB 1531 offers one model. It's trust the science, act fast, communicate clearly. If you pair that with sunset clauses or legislative review mechanisms later on, you can get both that agility and the accountability that you need.
Because let's be honest, smallpox didn't get eradicated because everyone got to opt out.
Exactly, exactly. We beat pandemics through collective action, and our laws should reflect that even when the politics makes it tricky.
Well, that is it for today's episode of Beyond the Bill Number. If you liked what you heard, make sure to subscribe, leave us a review, and maybe even text your state rep about HB 1531.
And if you're worried about the next pandemic, well, at least now you'll be sick with knowledge. So thanks for joining us in Looking Forward and Beyond That Bill Number.